The company is HealthSense. They're well-funded, went around B recently, pretty well, growing well in their particular solution that I'll talk about in a minute. So before we jump into telehealth, I know that's to some of you that may be monitoring health IT already know why there is a success story. It's not a big surprise, but still to the most people that I talk to, it's kind of strange, magical words. What does it mean? Because let's do a quick poll. How many of you guys here actually communicate with their doctors in an electronic way, by email or web portal? Okay, so that's a pretty actually good number. Maybe about a third of folks here communicate by email. And so how many of you actually, when you go to see your doctor, you end up with a piece of paper, either walking in or walking out, you end up with some piece of paper? Would it be everyone, majority? Okay. So that's the reality, and we're in the Silicon Valley. Right? That's the reality of healthcare. Still, by far, the majority of communication is done over paper. Faxing is still cutting edge. A lot of paper folders, a lot of paper moving around. It has deep historical reasons, but it's still a fact. I mean, what other industry would that even make any sense? So, what's obvious to everybody hasn't been obvious to the healthcare industry, and it still wouldn't be unless the government actually made big, bold decisions to do something about it. So I'm not going to get into the politics, like who lied to about what, and what is true about the insurance nowadays, and what the final outcome would be. But at least one positive track from the healthcare reform has been that there is an immense amount of funding going into healthcare startups, trying to make a difference, trying to make a change. And there's also an increasing number of states that are now legalizing telehealth. So being able to talk to your doctor over Skype, over video, that is HIPAA compliant, etc., meets some certain criteria, and the doctors be reimbursed for that time just as if you met him in person. So because of these significant changes at the regulatory level and opening the floodgates for investment, they are actually starting to show up some success stories, and hopefully more. The reason why I picked this case study is because it's so simple to understand what is the value that they offer to the market. It doesn't take much to get what it is. So let me jump into that. So what HealthSense figured out is that one of the areas in healthcare that is costing a lot of money to everybody, through Medicare, is caring for seniors. There's a lot of costs, a lot of inefficiencies there in the traditional systems, and with some high-tech, some innovation, these costs can be significantly reduced. The outcomes also can be improved. The time that the reaction time of caring for somebody who needs help is also improved, and in several cases actually save lives. A little bit about HealthSense, backed by more bigger names in healthcare and Verizon, to your points, like where is the money for telecoms? We'll get to that in a minute, but they're one of the backers. Okay, so let's get into the product. What is it that they are selling? So a lot of the IP for HealthSense is in their invention of sensors and the combination of how these sensors work together. So they, for example, have motion detection sensors. That's nothing new to anybody. Garage doors for it. But they also put those sensors in beds so they can detect pressure. Is somebody laying in that bed? Motion detectors, you can kind of guess what that is. Door cabinets, toilet flush. There's they also give a pendant to the patients that's for emergency calls. If they feel that something happened, we can just press that button and trigger an event. And then some basic vitals monitoring. Okay, so at this stage, nothing too fancy, right? But a combination of all these sensors have actually been able to quite reliably predict that a senior who has a pretty regular cycle throughout the day goes off that track and maybe something's going wrong. So that's the essence of the product on the sensor side. On the other side of the product is what happens when these events are detected. Like, could we get involved in what order, and how do we react to that? I'll get to that in a little bit later, a couple slides. So the way that the solution is delivered is a SaaS, not quite traditional SaaS because of healthcare regulations, like HIPAA and things like that don't allow products, services, and data to be run on public clouds like at Amazon, right, at this time, because they require certain patient data privacy protection. So they host everything on behalf of these healthcare facilities, but at their own data center, so they can make these guarantees about security. Roughly, the architecture looks like this. There is a data center that has the backend logic to predictive analytics, which gathers constantly data from these sensors. Which, by the way, I forgot to mention that each one of these sensors has a wireless connection back to the backend logic. So some over wireless network, some are Wi-Fi. But they constantly feed data continuously. And that's being analyzed, these predictive analytics, to make decisions intelligently, when to make a call, when to escalate that call, because obviously those algorithms don't work and they make calls for everything that happens left and right, that it's useless. So the part of the solution that has to do with communications is I use this our software, SYS-CON. We'll talk a little bit more about it. And it's load balance between multiple carriers for outgoing calls and inbound messages and calls. For folks that kind of have some experience in telecom, this gives an idea of the load that is going on. 75 concurrent calls, usually about the call takes about a minute or two, is quite a bit. That relates to millions of minutes a month of potentially life-saving calls. So let's take an example. So somebody's, at how we said started earlier. And one of the products from HealthSense would detect for a minute that she's off of the regular schedule. So it'll make a decision. Okay, let's escalate that. What do we do? Well, if there is nothing there that monitors well at that time, with the current state of affairs, there has to be a physical person, caregiver, who would have to be there physically to know that she felt, know something happened. And if she's not there, not around, we'll just keep waiting, maybe for hours, maybe for half a day, maybe longer. If something happens, traffic, whatever reasons, there were cases that I know of that almost 24 hours would pass before somebody knows that the person was on the floor and they couldn't do anything about it. Bad, right? Very bad. So what happens in this case? The system starts escalating these events, and it goes on a scale. Maybe it will notify literally the neighbor, hey, check with the neighbor, what's going on. Next step, escalate to a nurse. If the neighbor didn't answer, if the nurse would react in some way, all we know, well, is actually on her way to the hospital maybe, or they will at least check on the situation and make a decision, intelligent decision, what to do about it. Another thing is because of this vitals monitoring, the preventing an event, preventing an acute event is almost always, the research shows that it's almost always far better health-wise and far cheaper to react on early detection of a potential event, health change event, than to actually wait until the person needs to go to a hospital. So it's possible to feed that information to the healthcare team, and they can react and just for medication treatment or whatever it is ahead of time. There are some benefits to the staff as well, to the medical staff. In the traditional way of waiting on somebody to call and ask which nurse is responsible for which patient, and let's go run around the hospital to find out who's supposed to take care of that. Where things used to take 12, 15, whatever, 20 minutes to find the right person to respond. It's pretty common sense when you start automating these things to just call directly the nurse responsible for that patient. Pretty plain database connection to make. But when in the old way, with the old IVR systems, it's all people talking to people, and nobody remembers everything. Nobody knows what kind of changes occurred. So this type of solution has demonstrated benefits to patients, benefits to the medical staff. Obviously much cheaper to implement than having somebody physically always on, always available to be with each patient all the time. So it's already been deployed. There are tens of thousands of patients being monitored at this time. And Verizon has picked up on the potential. And okay, so now we're getting to the earlier question: where is the money for telecoms here? Okay, so Verizon has been trying to push Fios throughout the country. Lots of capacity, still available, highly reliable as compared to regular cell towers. And they already have a lot of these relationships with healthcare facilities who need that type of reliable communication and accessible from a reliable carrier. So they've actually partnered with HealthSense to jointly offer that. So you have the Verizon brand, guaranteed communication with this solution, which makes intelligent decisions together as an offering to the healthcare market. And in this case, it's a winning for all parties. Not only, once Verizon is in and they sell HealthSense, they can then go upsell triple other type of video, TV, whatever features. So it's the overall value is improved compared to the next telecom that does not have these additional services. So you can get maybe triple play. Say the next cable operator offers that, but does not have any guarantees or recommendations for what do they do in terms of telehealth. So then they have an advantage now when they go compete for the hospital business. Some other innovations that have been added onto the solution. This again has to do with predictive analytics and preventive care. Sending surveys to a patient regularly, once a month, doing an automated survey over the phone, asking questions that are related to their known conditions and potentially if they have a known history of treatments or medication or different health events, and questions tailored to that particular patient to gauge how their condition is improving or worsening continuously, regularly, versus once every 6 months or when something really bad happens. Yeah, another kind of intelligent behavior here is with the solution is that it's programmed to behave differently based on the time of day. There's one team of doctors or nurses or medical staff and one set of hospital procedures that apply during the day versus during the night. Okay, so kind of went through the case study, what it's about, and some of the takeaways have been that you can't really, to be innovative and to do things that are changing the industry, the way it works, and disrupt and break old models, and move from faxing to actually meaningful application of technology. You can't rely on old boxes. Go to most hospitals, they'll have these old IVR boxes, voicemail and some forwarding logic, completely disconnected from the fax system, completely disconnected from their patient database. So it's pretty much close to impossible to wire these things and make them talk to each other intelligently. So now this is the time to actually realize that, all right, it's time to move all these technology bits and pieces forward, modernize them together so they can behave like the rest of the market. In any other market, you have big data and all kinds of APIs and modern things to work with. So you can't do it with all telecom boxes. You gotta replace it with something more. Now, that's the pitch and leading into a quick overview of SYS-CON, which is the open source project that we support, we maintain, and respectively there is a commercial version that we make money off of. So a few words about what this product is. It is middleware. It does have multiple connections to legacy hardware. You can plug it into 6 scoop boxes or VIA boxes. In a data center, you can plug it into SIP gateways or internet. You can even plug it into SS7 infrastructure in a carrier's environment. That's on one side. And being in this type of business for almost 10 years now, it's become very clear that mainstream developers are super intimidated by anything that has to do with telecom protocols. There's a lot of asynchronicity, many protocols. It's been 100 years of communications. There's so much legacy stuff that piled on. And there are a bazillion ways you can do this. You can make a call through APIs and boxes and wires. It's pretty crazy. And we work with carriers and companies around the world. It's so different, even just within the carriers in the US. It's like stretched like that for doing the same thing. And if you go to Russia, it's a completely different story. Brazil, etc. India has its own world. What's legal, what's illegal. But at the end of the day, people just want to make a call. Call some API, WebRTC, not WebRTC, but the REST, maybe call, and somehow call happens. Okay, so that's the value of REST-CON. It's the middleware that on one side provides these connectors to legacy equipment. On the other side is an intuitive API. And we've decided that all the already invented web APIs for call control, we got to pick one. It's pointless to implement all of them or invent yet another one. And we got to acknowledge, totally hats off to the Twilio team for doing a wonderful job at designing another API on their own and marketing it very, very well to the mainstream developers and achieving success with that. So we wanted to support that, so we implemented those APIs on top of everything else that we've built over the years. And we're not worried too much whether we support this standard or that standard or the third web API standard. But there's one that works, it's available, it's there. So for folks who have done already some kind of web API telco development, this is not going to be big news. But to those who are now entering into WebRTC and real-time communications, which is the majority, I think, still developers, it is used as this relief to know that in order to communicate with a bunch of thousands and thousands of phones, desktop phones, mobile phones, all kinds of soft phones for PC, for desktop, for iOS, Android. For almost 90% of the cases, you don't even have to think about what's on the endpoint. That's taken care of by this middleware magic somehow. And what developers work with are web APIs. Pretty straightforward to understand, well documented with a living, thriving community. And there's a divider that abstracts a lot of the mess now. So moving closer to the topic of the day, how is WebRTC applicable in telehealth? So WebRTC is great, lots of hype, lots of buzz, makes total sense. I'm not going to spin the same message that's already everywhere in the media. It totally makes sense. But of course, it maybe invents that much and builds on that much of legacy protocols and standards that already exist. So naturally, it wasn't very hard to us to add support in REST-CON for WebRTC workflows, which we did. And we started talking to customers, like how would you use it, what would you do with it. So here are some ideas. This is a map of the implementation of the law allowing telehealth to be reimbursed. So when a doctor makes an appointment with a patient and they do it over video, they can, doctor can charge the insurance company and the patient can receive a treatment in a legal way. Some of you may have seen that doctors got fired, they got their licenses revoked because they were doing a Skype call with patients. And that does it make any common sense? Not really, but it's illegal in some states. Still is. More and more states make it legal, but it's not, some is still not. And there's some valid reasons. For example, Skype does not provide a HIPAA guarantee that they do actually protect the patient's data communicated over their channels. in the way that the law requires. So technology-wise, is it possible? Of course it is. But unless they sign that waiver, it's going to be a problem. Same with Amazon Web Services. I've heard that they're doing a lot of work quietly to be able to comply with HIPAA, but it's not the case yet. So you can't just run a healthcare type of software or service on Amazon quite yet. So anyways, back to this opportunity. Let me move on with some numbers. These are the predictions by eMedia and BCC Research about the telehealth revenues. So we have already a tiny bit of that proof, and these are the projections for what will happen. There are a number of chronic diseases that actually contribute to the majority of the healthcare costs. And there's plenty of evidence and research that has shown that if these chronic diseases can be managed and preventively, practically managed, the costs can sharply drop. And where does the American debt come from? Majority of it? Healthcare. So there are good reasons why these numbers are growing. Because for every dollar that is spent for telehealth, there's many more dollars actually saved from the current way of doing things. Okay, I'll get to the next one. By definition, by far the most widely communicated application of telehealth is video communication with patient and doctor. As simple and as boring as it sounds, it still is the major driver, the major application that is finally becoming legal, and technology is getting there to do it at high enough quality so the doctor sees the actual patient at high definition video and not some blurry, crazy image, and they're not going to make the wrong decision because of what they were seeing or not seeing, as opposed to physically talking to the patient. And so that's where the potential is. As you can imagine, with our customer, HealthSense and others, there are more things that they can do. So now there are sensors which are kind of quietly being there, but you can imagine a situation where an event occurred. Well, what would be an easier way to verify that a person just walked out of the house and is in the garden for a little bit, or they fell? How hard is it to have a camera which triggers a connection to a medical professional to verify, oh, what's happening to this person now? They're on the floor and it's on video, so you better move. Or they're out of the house. Okay, don't worry.
When you say telehealth parity now, there are multiple components to that, one is the provider, the insurance, also the person who is receiving the care. So just because the state has a parity now, does it mean that insurance is supposed to support it, or they cannot?
Okay, yeah, you're getting deeper into the healthcare business, but very good question. So the previous diagram. So this is what Medicare would reimburse doctors for. Now there is a transitional kind of bridge into the private insurance. So typically private insurance copies the behavior of Medicare. So even though there may not be required by law to reimburse for a telehealth visit, they tend to kind of follow what the government insurance does. So it's a little bit of a gray area there, but that's usually the trend. So thanks for calling it out. Of course, the biggest insurance in the country is the government. Enormous amount being paid out as compared to any of the private insurance, who are huge companies compared to any other private company, but compared to Medicare, whatever, startup. Okay, so a few kind of final points here. Unfortunately, still there is no quick way to get to that market. A developer building a solution for healthcare cannot use the most popular public cloud services. And because of these type of things, HIPAA and BAA, which is another thing that scares most of the public cloud services. Too much liability. So the path until the mainstream services are ready and clean up and in a position to be available to everybody for healthcare reasons, the solution is to do what HealthSense has done, which is to have their own private cloud that they control hardware end-to-end and make guarantees. There are several hosting companies like OnRAM, Firehost, which actually do provide these healthcare guarantees for HIPAA. And then on the software side, on the API, telephony side, there's at least two competitive solutions that I know about. And obviously one is SYS-CON, on.loop, which is my own stuff. And Amici, which is offered by the Tropo team, which I know the founder and the folks there, very high quality team, great software with global market, so very formidable competitor. So these are the solutions available now for anybody going into the telehealth business. Amici also supports WebRTC.
Do you see any of the vendors you had on the previous slide, trying to do this, building a sort of encapsulated access environment, or are they just not?
You mean like is Amazon offering?
More like Twilio or some of the hierarchies space. Or the fact that they're on Amazon, no problem with themselves.
Right. You mean the exposure that they can't make guarantees unless Amazon makes these kind of guarantees. So to be honest, I don't know what the priorities are in Twilio.
Healthcare is a big market. It's weird that
so,
people are talking about it.
Right. So I'm sure that those super smart folks at Twilio know they have seen this chart. I just don't know where they are and jumping in there. I know that Amazon is working in that direction quietly. How long it takes until an announcement is made, who knows? Good question, but sorry, I don't have a quick answer, a concrete answer. I think it's a matter of time for them to offer that type of solutions.
So, on to your next slide. Are there infrastructure as a service models within the private space, or is it all build your own with open source stuff?
Well, no, these guys on ramp, they're not in, I don't know what Firehouse is, but both of them are IaaS, infrastructure as a service.
Okay, so they deliver a private cloud for
I guess it's not private because it's not in the office of the company who's using them. It's in their data centers. I think it's public, but with those additional guarantees for security and privacy.
The main cloud.
I guess Amazon with extra security or something.
So similarly to his question, who is going to provide the field service? Healthcare provider or your company or ABC company? The many doctors' office, I don't think they have adequate personnel to maintain, to make sure all the information is gathered in through your communication to the crowd or whatever. So who's going to do the field support?
Right. So if we take this case study, HealthSense is a company who puts everything together, and they do the hand holding for the hospital, for the patients. There's actually a slide that I think gives some numbers around that. Yes. So yes. So HealthSense manages security, performance, and manages all updates, upgrades, replaces sensors when they're bad. All that. They provide reports in print to the doctors, so they can read. Doctors on a lot of them.
So your system will be considered as a part of the medical equipment, something like that. If something wrong, the supplier or whatever manufacturer will come to fix the problem.
I think you can roughly think of it like that. Yes, we provide one of the components that eventually.
The other way up from what you said, you're a component in HealthSense solution.
Exactly.
And
Yes,
HealthSense
yes.
takes ownership of the delivery.
Exactly. So we're just a piece on this bigger puzzle. So we reside somewhere here. I know.
Since WebRTC is point-to-point, so that like a private VPN that you establish between the provider and also the.
So let me make clarification. WebRTC is not currently used by HealthSense. What they use are these telephony APIs in the PSTN infrastructure to make reliable calls. They're actively studying, looking, trying to see if the time is right to implement WebRTC. The purpose of this presentation is just to share what are prospects.
So we've actually been asked by a number of healthcare companies to explore building an application provider web-based, WebRTC-based system. And so I get the issues in terms of the pros and cons of looking on Amazon's platform versus Firehouse. But can you speak to anything native within the WebRTC protocol that would make it HIPAA compliant or not HIPAA compliant? So I, as a developer, what would I have to be concerned about in that WebRTC world is building a HIPAA compliant solution?
I can bring up a couple of points, but studying HIPAA is unfortunately an exercise that I would recommend. And it's a moving target. Because HIPAA used to have to do with PCs residing at the hospital. They've been having a hard time and issuing a bunch of requests for expert advice on how to apply that to mobile apps, to data that sits on the app. On the phone. And what about data that travels from the phone to the PC? So it's a new world, and the government trying to catch up. WebRTC is a little bit of a chase. Okay, so I'll bring a couple of points that are known potential ways to break, to violate. So you know how WebRTC uses a DTLS SRTP for encryption of the media channel, but there are many ways you can screw it up. So first of all, DTLS SRTP relies on the fingerprint exchange for the two certificates to happen out of band, to happen through some undefined signaling protocol. So that right there is a big potential hole to mess everything up. So there is examples, there is RFCs who suggest how you may do that over SIP. But SIP itself, the SIP exchange itself has to be already a secure channel. Okay, so how do you secure SIP then? So then you maybe fall back on public certificate authorities providing keys to the endpoints so that SIP can be our secure channel. Potentially you can do the fingerprint exchange over HTTPS. That's an option. And be absolutely sure that the patient understands that when they go to the website, if there are any warning pop-ups, that the certificate of the web server is not approved, certified, they should not click OK. So these are some of the things to worry about. And then there are, even when you get into the media encryption itself, there are many ways you can mess it up too. If, for example, the server that you're using, because peer-to-peer connection is fine, but it doesn't happen magically. You got to go through a server. for these peers to find each other. Okay, and so if the connection or the media goes through a server for multiple reasons, for example, if you want to have an audio log of what the doctor said to the patient, then you got to put the media through the server. And then there are many ways that the server can mess things up. If, for example, it uses bad certificate, or an old certificate, or a stale certificate, or it uses certificate with multiple channels, then two clients will share the same certificate, and potentially there is a security risk there. So let me just kind of stop there.
But wouldn't you agree that WebRTC is adding to the problem? You've got these structural problems, whatever you use, if you're going to use real-time audio, video, data communications.
Definitely.
WebRTC is making things worse. It's requiring that everything is encrypted. It's giving you the application to follow the signal.
Yes.
So, it's giving you the ingredients. I think what I'm hearing, what's known is it's not easy to make things HIPAA compliant. It's not easy to have real-time comms and then demonstrate that meets the rules. But I don't think WebRTC is making things worse.
I agree with that. If anybody tries to convince you that WebRTC automates encryption and makes things magically secure and safe, that may be misleading you and potentially making things worse. But as long as it's clear that it gives you the tools and the standards to do it right, but you still get to do your homework and wiring correctly, then yes, it makes things better in that sense.
Actually, so SIP is not a requirement.
No, it's not. Yeah, WebRTC only deals with media.
Even for signaling side, you don't have to use the SIP.
Correct. I mean, some, like Amici, I'm pretty sure they rely on XMPP. They do support SIP, but recommend XMPP. For RESTCOM, we're SIP 100%. We do support, we're kind of the opposite. We do support XMPP if required, but almost everything is tested and thoroughly designed around SIP signaling. That comes with this legacy of 100 years of communication. We can probably put here 1,000 protocols that do that exact same thing. Which is the good thing about Tuli, this new generation platform that try to. Yes.
The question I have has to do with multilingual scenarios, and that's kind of my note I always touch on. Within telemedicine and within just medical care in the United States, the need for providing interpreting language services is huge. With these companies, are they taking that into consideration as they are building their infrastructure? Just to give a quick example, the Obama administration, about 2 months before the launch, on October 1st, of the Affordable Care Act and Obamacare and the exchanges, put out a little query of interest, asking if there were any companies capable of providing real-time language interpretation over the phone and in other media for 150 languages. Just this little query 2 months before it was going to launch. Clearly, as we've seen with all the problems that are currently being seen, they didn't have a way to resolve that, and clearly they didn't have it on their radar screen where they needed it. In fact, Obamacare is going to bring, I believe the estimates are around 10 to 12 million limited English proficient people into the healthcare system in the United States. And by federal law, they must have equal access to healthcare, which means if they don't speak English, these institutions that provide services and receive federal dollars must provide interpreting. So it is an industry that's growing. There are providers out there, but none of these shown here are focusing on language. I'm just throwing that out. I'm curious to hear.
Interesting. So you mean that the portal bombed because they tried to refactor it 2 weeks before it launched into international.
Well, that may have been one of the contributing factors, but.
All right, I'm kidding. So, yeah, obviously, all excellent points. One of the companies that we are working with now is doing live three-way video calls, but they're focused on speech impaired population.
Yeah, for ASL. Yeah.
So they will involve an interpreter who speaks the sign language, the patient and the doctor. But that's probably a blip on the radar.
In the larger scheme of things, yes, but again, when you factor in the other, several million that are coming in.
No, I mean that blip on the radar is also any companies mentioning interpretation, real-time interpretation or multiple languages. I haven't heard from any other company thinking about that.
As of today, I believe that WebRTC traffic is not being that freely allowed in many of this virus. Is that what you meant? Which will say that we should allow WebRTC without any discrimination as long as they have a mobile internet kind of connectivity. The traffic should not, the specific traffic should not be banned.
Oh man.
Because I know that even NT can they do sniffing and they kind of they don't allow it.
Yeah, you're getting into another mess. So yeah, there is freedom of internet in the US, but it has to do with cable communication. For mobile communication, the carriers can do whatever they want. They don't have to allow WebRTC. So I don't know. But hopefully that freedom of internet somehow applies to mobile at some points. But actually I hope for models to be found where it works for everybody. Yeah, because you cannot, I can always understand the carriers not to, right? You cannot be just throwing parties in your backyard and don't expect to pay for that. So yeah, it's still a moving sand. I know in Europe to some extent and to a big extent in emerging markets, Skype traffic, any kind of over-the-top traffic is slaughtered. Try to make a call from China over Skype to the US, forget about it. Forget it. Actually, from Shanghai it works, from Beijing, forget it. It's pretty bad state. So, I don't know, if for most of the markets, it has to be solutions that are like this kind, where Verizon makes money by pushing that type of solution, and everybody's happy. But if you're trying to go around them, I blame them always. I don't know. You asked me a tough question. Totally put me on the spot, I don't. Okay, I don't know how we're doing on time. Okay, so I think we're about up on our time. Are there any final points, any questions before we wrap it up? Okay, so I think that's it. Thanks everybody for coming in here. I was expecting actually most people to be so hungry and ready for lunch that they wouldn't show up. Appreciate it.